The respiratory virus that has sickened hundreds of children in the Midwest and South is now in the tri-state area. New York, New Jersey, and Connecticut all have confirmed cases.
CBS 2's Dr. Max Gomez went to Westchester Medical Center where some cases are being tested. Dr. Max.
Well, that's right, Maurice and Christine. The culprit germ is called enterovirus 68, or EV68 for short. It's one of a large family of viruses that cause the common cold. What's new about this virus is that it seems to be causing a more serious respiratory infection, especially among children.
He was white as a ghost, lips were blue. He was completely unconscious at that point.
Jennifer Cornejo is describing what happened to her 13-year-old son when he got critically ill with EV68. That was in Colorado. Now, as expected, EV68 may have arrived in New York. Here at the Maria Ferrari Children's Hospital at the Westchester Medical Center, doctors have tested a number of children for the family of viruses that includes enterovirus 68.
Patients who have tested positive for rhinovirus and enterovirus, as well as other viruses. We're still seeing plenty of viruses.
But the hospital test doesn't specifically identify the EV68 strain. That confirmation will take up to a week to get from the state health labs. The reason doctors are concerned about this particular virus strain is that it causes more severe infections than other cold viruses.
It can cause more severe respiratory disease, particularly in children. Severe wheezing, difficulty breathing, shortness of breath, requiring oxygen.
Children at highest risk are children with asthma or kids like 2-year-old Aiden Campisi.
He already has some respiratory problems now that we have to address every so often.
While the virus has caused serious illness in a number of children, for most it will be no worse than a bad cold. Still, prevention is the best approach. The same is for the common cold. Good old-fashioned hand washing or alcohol-based hand sanitizers. Avoid touching your eyes, nose, or mouth, and cough into your elbow or a tissue.
I don't see any cause for a major concern.
Now, doctors stress that there's no need to panic. EV68 is a cold virus, a nasty one, but one that the vast majority of people will recover from completely without any need for special medical attention or hospitalization.
It's always so worrisome, Dr. Max, for parents. You know, do I call the doctor? Do I not call the doctor? What is this, or rather, what are the signs that we should be looking out for?
Exactly. There's a couple of things you should look out for. First, any child or adult, for that matter, with lung issues should be carefully watched. And in any child, wheezing, excessive use of an asthma inhaler, shortness of breath, those symptoms should probably be seen by your pediatrician. But if the child really has trouble breathing, then a trip to the ER is probably a good idea. But runny nose, cough, even a little fever, don't clog up the emergency room. You're going to spend a lot of time there, and they really can't do anything for you there that you can't do at home.
All right, Dr. Max, thank you.
Thank you. Well.